Welcome to Chart Talk and the Clinical Quality Package, the next step forward documentation, management, and creation for your clinic. The Clinical Quality Package is really meant to go beyond electronic health records. It will help you participate in PQRS, the Physician Quality Reporting System, implement functional outcomes, and digitize documentation in your office. It will help you score information and store it electronically, minimizing the space in your database, the mobility to access critical patient data through your phone, tablet, or any web-enabled device. With ChartTalk hosted services, you get a solution to many of your IT networking needs. Your connection is secured. Back it up with a platinum backup package. Talk QIK helps you chase the paperless office. It has a patient, provider, and staff features, and it's designed for tablets, laptops, and most any device. ChartTalk Cloud is our latest. It's a web browser-based version of ChartTalk that allows you to access data important to you. Let's take a look and see how this works in action and how the data flows seamlessly when you're a member of the Clinical Quality Package. When we first look at the Clinical Quality Package, let's take a look at QIK. I'm not going to go through the patient portal side of this. You can see that in another demonstration. We're going to go through the staff and provider interface. And you can take a look at today's visits. Who's going to be in today? So here's my schedule of patients. I'm prompted with the notifications, which help with patient education and clinical decision support. And this is a basic place I can look over the patient. If I need to schedule a functional outcome measure, say the patient comes in for knee or low back problems, I can easily just right-click on that form, add that QIK form for the patient, and next time they log into QIK, they will be prompted to fill in those functional outcome measures. You can look at the progress of the patient by selecting Functional Assessment Chart, and then you'll see any functional outcomes that the patient has been filling out have been scored, and you can see the graph over time. So here's the knee outcomes, the low back disability index, and you can flip over, you'll see the messages. Inter-office messages are being put in on the patient. The messages tab will turn yellow. Then you can also select on the patient, select SOAP note, and you'll see today's SOAP note, the beginning of which has been filled out because the patient filled out their information quick. We can see that the chief complaint is logged in the patient's own words. We've got the frequency and the quality of pain. A numerical pain scale is 9. Patient is responding well to treatment today, period. Their score of -15 from the previous Oswestry form that was done shows that treatment is working well, period. Assessment 6. Cervical plan. You can then hit save. Another cool feature is you can actually take 3 notes, compare them side by side. Pretty neat little feature. People have been asking for that feature for a long time from us. The proper G codes for demonstrating PQRS are automatically populated into the billing codes. So it does a lot in the background to help streamline your workflow, make sure you're gathering the right data across all portals. So that was QIK, but what if we go and check out ChartTalk Cloud? So here I'm in a web browser, and I'm looking at my schedule for today. So here's the patient we were just looking at. I can click on the patient and go to a patient overview screen, where I've got the visits, latest visits, problem lists, or I can just jump right to the SOAP note itself by clicking on the SOAP note date. So there you see that all the information we put into QIK comes right over into ChartTalk Cloud. So if I want to add any more, the patient's range of motion is improving when he turns his neck left to right, period. That's working with the ChartTalk SR speech recognition software, which is also a cloud-based product. When we're done, I made some edits. So So I'm going to come down here and add ICD-9 codes, add CPT codes. All this information will be reflected in Chart Talk and in QUIK. And the clinical package, make it so you can bring your data and synchronize it wherever you go without having to do a lot of IT work. So there we've selected the patient. You can also look at past visits, general information on the patient. And you'll see here we've got some new, like family history, and social history, meaningful use phase 2 requirements, and some new information you'll have to have on your patients. So if we go back to Chart Talk, we can click on the patients and the visits, and here is all the information that we put into the web browser using Chart Talk SR and the Chart Talk Cloud and QUIK products. Thank you very much. That was the Clinical Quality Package, which consists of Chart Talk hosted services, Chart Talk QIK, and Chart Talk Cloud. 3 products that help you extend what you can do with your electronic health record